I'm Dan Morrow from Education and Beckman, and I'm going to tell you briefly about a study today with educators, including Renato, who's sitting here, one of my students, and Mark Hasegawa-Johnson, who has been here, he's here, and Tom Huang, and their students. So it's a collaboration between education and engineering, and Bill Shu, who is at Carl. So this is a health related project that is taking place in part at Carl. Okay, so we start with the observation that learning is vital to health across the lifespan, in part because we are now empowered patients who kind of take care of ourselves, and so we need to learn a lot about health in order to do that. This is especially the case for older adults because they're more likely to have complex chronic illnesses like diabetes and hypertension that require complex self-care. And yet they have fewer cognitive and literacy resources to kind of handle that complex task of learning a lot of information. Traditionally, older adults, patients of all ages, rely heavily on face-to-face interaction with providers, that sort of communication with providers in order to learn about self-care, to sort of provide support for self-care. That is unfortunately less and less true because there's less and less time for clinicians to interact with patients. Older adults especially interact with multiple specialists, so there's fragmented care issues. So increasingly we kind of look at the benefits of technology for overcoming some of these problems with communication and learning of self-care information, especially for older adults. But the caveat is it has to be very well designed, the technology. So our project focuses on a particular example at this point, and it's patient portals to electronic health record systems. So ideally, electronic health record systems support coordinated care across multiple sectors, multiple providers. Everybody should be on the same page because of a sharing of electronic sharing of health information about a patient. It's also more and more, there's a call for electronic health records to support patients by providing continuous access to information about their health and to provide an important scaffolding for patient-provider communication. So it's sort of, electronic health records are really supposed to help patient-centered care. And there are Institute of Medicine reports that point this out. And again, the reality is a little different so far. I mean, this is a rapidly changing area, but patient portals tend to be more repositories. They function more as repositories of often numeric quantitative information like clinical test results that are given to patients, pushed to patients. That are, especially older adults with limited literacy and numeracy skills, have trouble understanding that information. And ironically, there's also some evidence that the use of patient portals may further reduce face-to-face contact rather than support and increase the quality of face-to-face communication or collaboration. So our project is trying to look at portals and think about them in ways to make them more helpful as collaborative tools rather than just repositories of patient information. And this particular focus is helping older adults understand things like clinical test results. So here's an example of what you might get if you log on to a patient portal. You've just had your cholesterol test. You'll get a table with numbers, total cholesterol, triglycerides, a little bit of information about the dimensions, the scale, the range, but really there's not very much context here outside of the clinical interaction to understand the meaning of the implications of these numbers for risk for heart disease, for example. And so portals tend to sort of strip numeric information from the clinical context. And can we do better? All right, so this is our project, is trying to improve the presentation of cholesterol, diabetic test results in order to help older adults especially understand. So what we're doing, working with people in engineering, is leveraging progress in computer-based agents in a variety of different contexts where nonverbal cues like tone of voice and facial expression, as well as well-chosen words, can help to can help people to better understand this numeric information. So let me give you an example of that. So this is an example of the kinds of materials we're developing. So we're trying to graphically provide context for patients to better understand the implications of these same four numbers that you saw on the table that are now embedded in a richer context for understanding the information at a more qualitative gist level rather than just trying to memorize four numbers that are not going to be very helpful. So that we're doing that. At the same time, we have videotaped a retired physician at Carl who is providing high-level commentary about the meaning of these four numbers for your health. So where we are right now is we're about to start an experiment where we see if people better understand at a gist level and are more engaged and more motivated to respond to these numbers if they're graphically conveyed and accompanied by a videotaped commentary from a physician in a portal environment. At the same time, Mark and Tom and their students are taking this videotape as input to develop the computer-based agent with voice synthesis so that we have not an endless series of videotapes of a physician, but a generative communication device that will allow patients to understand all kinds of different kinds of information. So so just very quickly, this is the first cut of the avatar or the conversational agent. We're working on making that 3D rather than 2D, and we're working on the speech. Mark and his students are working on the speech synthesis side of this. And so what we're hoping is that compared to the standard portal format, that the computer-based agent will help older adults better understand sort of the bottom line of the information for what they need, what it means for their risk, and what they can do to mitigate that risk, and to support decision-making and collaboration with their providers. So to wrap up, the long-term vision is your physician gets your results from your cholesterol test. They sit down at their computer, they sort of annotate with emotionally relevant labels, words to promote risk perception that drives the computer-based agent in the portal environment, so the patient's viewing that at home, and so that they're more likely to understand and be engaged by that information so that they understand what they need to do to improve their health care, which then further scaffolds better quality collaboration face-to-face with the provider. So it's not that this is supposed to replace a face-to-face collaboration, but it's supposed to support more continuous care across those few brief contacts we have with our clinicians.